Patrick Hudson from intensivcarehotline.com with another quick tip for families in intensive care. Today I want to talk about when is TPN indicated for a patient in ICU. So whenever enteral feeds or oral feeds cannot be established, that means whenever someone can't have nasogastric tube feeds or PEG feeds or can't have oral feeds, that's when TPN is indicated. What is TPN? It stands for total parenteral nutrition, and it is basically intravenous nutrition. It requires a central line, a PICC line, a Hickman's line, or a port catheter to administer the TPN. Now, for patients in ICU, it's not often the case, but it is certainly the case on and off. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and where I've been consulting and advocating for families in intensive care since 2013 here at intensivcarehotline.com. And I can very confidently say that we have saved many lives as part of our consulting and advocacy. And you can verify that on our testimonial section at intensivcarehotline.com, or you can verify it on our intensivcarehotline.com podcast section, where we've done some client interviews. Now, currently we are working with a client that needs TPN in ICU. He can't have any nasogastric tube feeds, he can't have any PICC tube feeds, and he can't have anything orally because he's BiPAP dependent on high oxygen levels, on high IPAP, high EPAP, and he's unable to have any enteral feeds because of that, or oral intake, right? So that means he needs TPN. Now, the ICU team is very difficult in this situation because they're saying, well, we shouldn't give any TPN because there's a risk for infection. Well, from my perspective, that's like saying, well, we shouldn't be eating and drinking because food or drinks might be contaminated, right? Is there a risk for an infection? Of course there is, but there's a much higher risk of not feeding someone in ICU, because the research is clearly saying that ICU patients need to have nutrition from day one to manage critical illnesses more effectively. There's enough research out there. So by not giving TPN or by withholding nutrition, that is actually medical negligence as far as I'm concerned, and it's weakening an already weak patient, right? And it's just highly inappropriate. So the bottom line is, you as a family in intensive care, you need to do your own research, and you need to get a second opinion so that no one is taking advantage of you, because ICU teams have their own agenda, and that is often to get patients out of ICU as quickly as possible, which could include not giving nutrition, which could potentially kill a patient. So please also keep in mind, always bring it back to common sense. Nutrition is a basic human right. So to say that we shouldn't be giving TPN because there's an infection risk, like I said, once again, that's like saying we should stop eating and drinking because food might be contaminated. But there's a small risk for that. And in ICU, from my extensive experience, a line infection is a small possibility, but if it's managed correctly with the right skills and with the right experience, there's actually no problem. For example, some of you watching this might know, we are providing also a service, intensive care at home. And you can find more information at intensivcareathome.com. At Intensive Care at Home, we are also providing home TPN. That means some of our clients are at home on TPN, and we are therefore sending our critical care nurses into the home for TPN and manage central line, PICC lines, Hickman's line, port catheter, no problem. And the lines don't get infected because it's the skill that we bring into the home that prevent that from happening in the first place. So over the years, we have helped hundreds of clients and members here at intensivcarehotline.com, families in intensive care. And like I said, we have saved many lives. And that's why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivcarehotline.com, if you click on the membership link, or if you go to intensivcaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded, sharing all of my 25 years of intensive care nursing experience and advocacy with our members, making sure you make informed decisions, you have peace of mind, control, power and influence, making sure your loved one gets best care and treatment always. I also do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I talk to doctors and nurses directly. When I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. And when I do one-on-one consulting with you and your family, I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell. Comment below what you want to see next, what questions and insights you have from this video. Share this video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification for the YouTube live if you're a subscriber to my email newsletter at intensivecarehotline.com, or if you are a subscriber to my YouTube channel here. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.